All right. Good morning, everyone. It's good to see you all, or at least have you here. I can't see all of your faces, but it's good to have you join us this morning. My name's Steve Huntsberger. I'm the president of the Indian Valley Chamber of Commerce, and glad to have you with us this morning. We put on a variety of educational seminars every year, and we are really happy to have Everence Financial with us today. We have the managing director, Randy Nice, and we have two Medicare professionals with us, Leah Ludwig and Cassandra Zetts. And, there has been a lot of change in the workplace, right? So as we see people working past the age of 65, it's really important to understand what our options are for Medicare in the workplace and what does that look like. So we're happy to have Leah Ludwig and Cassandra Zetts with us this morning, and they're going to present on Medicare 101. I'll just do a real quick introduction of Leah and Cassandra, and then I will turn it over to them. We will also have a slide deck that I'll be sending out afterwards, and I think we will be able to go ahead and probably use the chat feature if you have any questions. But we'll certainly have time at the end for some Q&A. So, by way of introduction, Leah Ludwig is a CSA, and she is a financial consultant specializing in Medicare. She works out of the Souderton office. Actually, both she and Cassandra work out of the Souderton office. Really working with professionals and organizations to help them understand and navigate the complexities of Medicare. She and her husband live in Bucks County, and they parent two wonderfully curious boys. I remember what those days are like. And Leah gives time to her church, serving in lay leadership. Also happy to have Cassandra Zetts with us. She is also a CSA and works out of the Souderton office, working with Medicare. So we have really two very competent and dedicated professionals here with us today. She and her husband live in Souderton and have a 4-year-old and 1-year-old. So they are busy running, I think, with little ones. So I will turn it over to Leah and Cassandra, and I'm glad that the rest of you have joined, and I'll keep letting folks in as they show up. Leah and Cassandra, and I will go ahead and mute myself.
Thanks so much, Steve, for that introduction. Busy is a good word to describe us. So thanks for all of the wonderful Indian Valley Chamber companies that are joining us today or watching this in the future at some point. It's wonderful to be with you guys this morning. Like Steve mentioned, there's two of us here today that will be presenting. My name's Cassandra Zetts, and Leah Ludwig will also be speaking in a few minutes. If you can't see us in the Zoom, you can see our faces there on the first slide. Some of you may have heard of Everence before, but if you haven't, Everence is a faith-based, member-owned financial services organization that provides a range of services that help people make decisions about their money that reflect their faith and values. We've been around for more than 75 years, and we offer things like banking, insurance, and other financial services in ways that encourage stewardship and generosity. Everence has offices throughout the United States, but it's our opinion that the very best Everence office is here in Souderton. We used to have an office location on Main Street in Souderton, so you might remember us from there. But we now sit just off of Broad Street, sort of behind the Broad Theater and Broad Street Pizza. There are about 15 of us here in the Souderton office, but we are part of a larger network of about 300 Everence employees nationwide. Leah and I see ourselves as insurance counselors and Medicare educators, and in general, Everence is really focused on helping individuals, professionals, and organizations understand Medicare and all that comes along with it. Before we dive into our presentation, we want to go over some logistics. So feel free to jot down any questions that you have, take notes as we share with you today. This presentation is being recorded, and like Steve said, it will be available on the YouTube channel. It will also be linked in a forthcoming HR newsletter that will be coming out to you. So if you want to go back and watch certain sections again, that will be totally possible. If you're interested in a PDF version of the slides or some other resources about some of the things we talk about today, Steve will be sending that out following up the presentation as well. So you're welcome to submit any questions during the presentation in the chat, like Steve said. Feel free to throw things in there as they come up. We may stop and answer some of those questions that are more pertinent to a particular topic before we move on, but there will be a final Q&A session kind of at the end. So if there's anything lingering or anything we didn't address, we can circle back to it at the final part of the presentation. So we will kind of interact with you throughout the presentation. We might ask you to answer a question in the chat or raise a hand or something like that. This slide tells you to use the Q&A button, but I don't believe there is a Q&A button on your toolbar. So you can ignore that, just use the chat. And if you at any point can't find that chat button, just hover over where your toolbar typically sits. Usually it's at the bottom center of your screen, and it should pop back up.
Thanks, Cassie. So while being a Medicare expert may be beyond the purview of most in management and or HR professionals, we have engaged with enough of you in our time as Medicare consultants to know that there's a real value added when a company's HR team is equipped with the basic understanding necessary to help employees navigate the often confusing transition to Medicare. So we wanted to start out by pointing out a few reasons that you may find this information, today's presentation, worthwhile. So first, let's talk about the increasing retirement age. I mean, that's what Steve was talking about a little bit. Does anyone have a guess as to the average retirement age back in 1991? Feel free to throw in your guess into the chat. I'd be interested to see what people think that age was. Okay, we got a 63, 67, 69, 65, 55. Okay. Yeah. Okay. So 62. The answer was 57. The retirement age in 1991 was 57 years old. Obviously, that age is steadily increased over time with no sign of necessarily slowing down. So while Medicare is available to most people at age 65, many people are not retiring at 65. They're retiring years later and may have misinformation about penalties and deadlines that are associated with that. Second, we know that company culture is really important to many business owners, those in management, and HR professionals. Many people that we help report that they feel a real sense of care when their companies support them through this transition, especially those people that have had really lengthy careers within a company. This gives them a real positive ending to that time with your company. Third is smooth transition. So the better you understand what employees need, the less likely it is that you'll receive phone calls or follow-ups in the future. A smooth transition is good for everybody. And then third, or finally, saving money. Ensuring that your employees can move to Medicare when available and or necessary can help save the company some money through decreased healthcare benefit costs. So now that you know our why we're going to talk to you about this topic, let's talk about the agenda this morning. So first, we're going to talk to you about the Medicare basics. Then we're going to talk about the initial enrollment period and special enrollment periods. And lastly, we'll discuss what happens beyond enrollment. So in each of these sections, we'll be sure to highlight items that are important to you as an employer. Like Cassie said, we might stop and take questions if you throw questions into the chat, just to make sure that you're tracking with us.
All right, so today we're going to talk a lot about different Medicare related terms, as well as referencing the different parts of Medicare, which happen to be distinguished by letters. So Medicare can sometimes feel like it's its own language. So for that reason, we're going to start off with some Medicare basics to help you kind of follow along with us as we move through those different pieces today. So there are 4 parts to Medicare, which include Part A and Part B, which make up original Medicare and are often referred to as core benefits, as well as Part C and Part D, which are optional programs that were developed relatively recently in Medicare's history. Medicare Part A covers inpatient services, while Medicare Part B covers outpatient care. You can see some of those services listed in the first row on the chart on this slide. While Part A is free for most people, Part B does have a monthly cost. And in 2024, that base cost is $174.70 per month. Both A and B are provided through the federal government. Medicare Parts A and B together cover about 80% of an individual's medical services, leaving that person responsible for 20% of the cost that's not covered by Medicare, and there's no out-of-pocket maximum for that 20%. Medicare Part C is a private insurance alternative to Parts A and B and is also known as Medicare Advantage. Part C was developed for private insurance companies who wanted to continue to offer coverage to folks who qualified for Medicare. And they can do this now through offering Medicare Advantage plans, which would again replace Medicare A and B. Under Medicare rules, these plans are required to cover what Medicare would cover under Parts A and B at minimum, so about 80% again, but they can repackage those benefits in different ways. Medicare Part D is the only letter that makes sense. It's D for drugs. It covers prescriptions, and this is optional private insurance that helps pay for drugs. There are a few things that original Medicare does not cover. This includes dental, hearing aid, eyeglass coverage. Medicare does cover everything related to the medical care and treatment of your eyes, but not like a typical refraction test or lenses. Medicare is also not a long-term care insurance, and it does not cover gym memberships.
Okay, thanks, Cassie. So now that you have your basic Medicare lexicon, we're going to talk about when, how, and why your employees might move to Medicare. To do this, it's important to understand that there are like 2 key factors to consider when it comes to helping your employees. So first, it matters when the employee is moving to Medicare. There are different rules and requirements during different enrollment periods. A second key factor is the size of the company for which you all work. Medicare has different coordination of benefit rules depending on if you represent a small group or a large group employer. So another opportunity to engage here. Does anyone have a guess as to what Medicare considers a large group? So feel free to type into the chat what that number is, that threshold that you think Medicare uses to consider a group large. $150, 55 employees, 50, 100, over 50, 500, 200. These are all good guesses. So the answer is 20 employees, which is interesting. We didn't have anybody too close to 20. So to determine your size, Medicare considers all the people you employ, whether it's part-time or full-time workers. If you are a small group employer and you're unsure how to determine if you have at least 20 employees, feel free to reach out to Cassie or I, and we can give you some more specific instructions on how to determine that number. So not only do those turning 65 get to celebrate reaching an awesome milestone, but they also have the opportunity to enroll in Medicare, which is exciting. Upon turning 65, your employee will enter their initial enrollment period. So this period consists of the 3 months before that employee's 65th birthday month. It includes their 65th birthday month, and it also includes the 3 months following their birthday month, so a total of 7 months. And this is generally someone's first opportunity to enroll in Medicare. So we're going to show you an example of what this window can look like for people. So let's say this person turns 65 in June. So if that individual takes action to enroll in Medicare in March, April, or May, Medicare will automatically begin for them as of June 1st. If that person waits till June to enroll in Medicare or any of the following months, July, August, or September, what will happen is Medicare will automatically begin for them the first of the very next month. So if that person waited to enroll in Medicare until June, then Medicare would automatically go into effect for them July 1st and so forth. So we always encourage people to be as proactive as possible and get this process started on the earlier side of their initial enrollment period. Certain individuals will absolutely want to and may need to enroll in Medicare during their initial enrollment period. And this is dependent on a variety of factors. One of those factors is the size of the company that individual gets their health coverage through. So we're going to look at some different Medicare enrollment rules as they relate to the size of the employer. So we're first going to look at small group employers or individuals that may receive their health benefits through a small group. Medicare considers employer groups small when it contains less than 20 employees. So I'm just curious, do we have anybody with us today that supports a small group employer? If so, type into chat about how many employees you support. We might have all large groups with us today, but let's see. Okay. So we do have some small groups with us, so that's good. Okay. We're going to talk about them anyway. So if you are in an HR role with a small group employer and an employee comes to you and they want advice on what they need to do about Medicare and when, that employee must enroll themselves in Medicare Parts A and B during their initial enrollment period, during that 7-month window around when they turn 65. What happens when that employee is on a small group plan and they turn 65, their coverage automatically changes from being their primary insurance to being their secondary insurance. So that employee must enroll in original Medicare Parts A and B in order to have primary coverage. Otherwise, they wouldn't have any primary coverage. And if something happened, heaven forbid, they had to go to the hospital or the doctor, there would be no primary coverage for that provider to bill. And so therefore that secondary coverage would kind of be null and void. Also down the road, that person, if they don't enroll in Medicare right away, may experience late enrollment penalties related to Medicare. So once the employee enrolls in Medicare as their primary insurance, they can choose to keep their small group benefits as their secondary insurance, or they could get separate secondary insurance. If the employee decides that they want to keep those small group benefits as their secondary coverage, then they would just want to make sure that that coverage includes creditable drug coverage so that later down the road, they don't get some sort of late enrollment penalty. So moving on from small groups, small employer groups, some of your companies may have employees that have their own individual insurance, like freelance workers or contractors. These individuals also need to enroll in Medicare during their initial enrollment period in order to avoid Medicare penalties or delays. So, maybe they have a policy through the marketplace or Penny, something like that. So individual insurance cannot be kept as secondary insurance. So these employees would want to consider picking up some sort of secondary insurance beyond having original Medicare. Another scenario that we see is when an employee is part of a multi-employer or a multiple employer group health plan. And this is when several small groups band together to provide their employees with health coverage. So in this case, if any one of the groups within the multiple employer plan has 20 or more employees, then all of the groups within that multiple employer plan are considered to have 20 or more employees, are considered to be large groups. So we see this a lot when small groups get benefits through like a business organization or a trade association, like a chamber of commerce, or churches get benefits through their denominational organization. So this provides the employee with the benefits of participating in a large employer group health plan while actually being employed by a small employer. So before we dive in to talking about large group employers, I just kind of wanted to take a pause and see if there's any questions. I mean, I don't see any questions that have popped up in the chat just yet. But if there's any questions about small group, okay. So if we are a small group, does that mean over 65 cannot join the plan? So they can Cassie, do you want to like chime in here too?
Sure. So yeah, someone on who's over 65 can join your group health plan, but it will be a secondary insurance for them. So they have to have original Medicare A and B if they are getting if they're 65 and they work for a small group employer. They can stay on your coverage or join your coverage as a secondary insurance, but it wouldn't be a primary insurance for them. So it couldn't be the only thing they had.
Yeah, and also, I don't know if I mentioned this, but they can also keep just the prescription drug coverage of the small group plan as well. Like when I was saying that they can be on Medicare, keep the small group benefits, they can also keep those small prescription drug benefits too, small group prescription drug benefits too. Okay, that was a good question. So we're going to move on now to looking at large group employers. So how many of you, I mean, we kind of got the gist of this when you guys answered this question before. It seems like a majority of you are supporting large groups, so 20 or more employees. So if you are a large group employer and you have employees come to you and asking what they should do as they approach Medicare age, you can tell them that they actually have a good number of choices. So when an individual is covered by a large group employer plan, their benefits remain the same, remain as their primary insurance. Nothing's changing. So they don't technically need to do anything because nothing really is changing for them. So if that person is looking to retire at age 65 and they're coming off of the work benefits, then yes, they would want to enroll in Medicare, but that's simply because they're losing their existing health benefits. If an employee plans to continue to work, and we're seeing more and more of this, they can choose to just enroll in the Part A side of Medicare. Like Cassie mentioned, the Part A side of Medicare is free, and it becomes that person's secondary insurance. The individual then would hold off in enrolling in Part B of Medicare because you pay to have Part B of Medicare. An employee could also choose to, get onto Medicare and drop those group health benefits. It's totally up to them and get some kind of additional coverage. So there's lots of different options that a person has when they work for a large group employer.
Question just come into the chat, so let's see, check over there. If over 65 and part of a large group, do you have to enroll in Medicare Part A?
Yeah.
No.
Yeah.
Yeah.
It's a really good question. You don't have to, you certainly can. And we meet with people all the time to kind of talk through this. It's something you can pick up. It's free. It's one less thing that later down the road that you have to enroll in. You'll get a Medicare card. You'll have a Medicare number assigned to you. Cassie's just about to jump into some considerations and why someone may or may not want to enroll in just the Part A side. So I think that this is a really good lead in to this next section.
Yes. I promise we didn't plant Jeannie to ask these questions, but she's asking good ones. So one thing I'll mention before I hop into these common considerations is that if somebody is taking Social Security benefits, they're taking early Social Security benefits before they turn 65. When they turn 65, they will automatically be enrolled in Medicare Part A. And so Part A then kind of would be in place. But aside from that, no, they wouldn't. So here's a list on this screen of some common factors that a large group employee might want to consider when they're trying to decide between those options, what to do. Should they enroll in Medicare either partially or entirely? Should they push off Medicare enrollment and remain on their group health plan until they retire? Lots of different considerations here. So the types of benefits being offered, income-related monthly adjustment amounts, which is IRMA, that acronym there, and health savings accounts, or HSAs, are three of the most common considerations we talk to people about. We recognize that your job is not to help an employee figure out what they should do, but our goal in talking about this section of common considerations is just to help you understand why you might have an employee who may or may not leave your group health plan at 65. So let's take a closer look at some of these. The first consideration is benefits. We often meet with individuals to help them weigh the pros and cons of keeping their employer benefits versus transitioning fully to Medicare and having their own insurance. Cost is one of the big components of this conversation. The portion of the premium that the employee pays, how comprehensive the benefits are, etc. It may make one option an obvious choice over another. With group health plans, most of the time your employer is paying a good chunk of those monthly premiums. When you move over to Medicare, you're taking on the full burden of that cost. Secondly, on the screen, the cost of prescriptions can be a major decision maker. Generally, prescription drugs are lower cost to an employee while they're on commercial insurance. And while dental and vision benefits are usually looped into an employee's group health plan, when an individual moves on to Medicare, those benefits may not be as readily available or for as low a cost as they are in the group health plan. And finally, coverage for dependents is a major consideration for an employee. Sometimes it may make sense for an employee to move to Medicare and drop their group health plan, but it would kick off their dependents, and they may have a spouse who is younger than them, not eligible to stay on the plan if they leave, or they might have young kids who are on the plan. So that's another factor we often talk through with people. Another consideration is for workers who may be high income earners. The income-related monthly adjustment amount, or IRMA, will come into play for these folks. If you have an employee, maybe it's someone in upper management that might be a higher income earner, they should be aware that they might be charged more to have Medicare Part B and for their Part D prescription drug plan due to their modified adjusted gross income. As soon as that employee enrolls in Part B of Medicare, they would be assessed a higher premium amount based on tax filings from 2 years prior. Social Security also takes tax filing status into account, so the income limits are different for those who are filing singly versus jointly. And you can see those 2024 limits on the screen. IRMA can drive up Medicare costs and therefore make an employee want to push off transitioning to Medicare so they can avoid those higher premiums for a longer amount of time. Another tricky factor may be if your company offers a high deductible health plan and whether or not those plans come with health savings accounts. HSAs are funded by pre-tax dollars that an employee can set aside to be used later for medical expenses. Some employers also contribute to their employees' HSA accounts. These can be a great asset for an employee. If you have an employee who is covered by a high deductible health plan without a health savings account, and they plan to continue to work, it would likely be beneficial for them to enroll in Medicare Part A only while they continue on the large group health plan. Because in this circumstance, Part A would act as an individual's secondary insurance. So if that individual would need inpatient hospital care, which is what Part A covers, Part A would coordinate with the high deductible health plan and limit the hospitalization expense to the Part A deductible, which is $1,632 in 2024, instead of the large deductible that they would have on the high deductible health plan. However, in general, the rule is that you can't be enrolled in any part of Medicare and contribute to a health savings account. So if your employee is on this high deductible health plan and has a health savings account, we want to encourage them to not enroll in Part A because they could face a tax penalty if they do. So if they want to continue working past 65, they want to keep that health savings account, they want to continue to contribute to it, then we'd encourage, again, just hold off and enrolling in any part of Medicare at that time. One clarification is that this rule is for the HSA account holder only and not their spouse. So if you have an employee with a health savings account and their spouse wants to move to Medicare, that's not a problem. Once on Medicare, beneficiaries can still use all the money that they have contributed to that HSA over the length of that account's life for various healthcare costs. So again, it could be a really beneficial thing, it just is a little bit tricky with tax. Okay, so we talked about an individual's initial enrollment period, why an employee may or may not transition to Medicare during that window of time. Now we're going to just quickly look at how someone who is in their initial enrollment period can enroll in Medicare if they choose to, or if they have to. Individuals will work through the Social Security office to enroll in Medicare. So even though Medicare health benefits and Social Security income benefits are two separate programs and a person can be enrolled in one without the other, Social Security does handle the enrollment and the billing for both of the programs. So the quickest and easiest way for a person to enroll in Medicare during their initial enrollment period is through the online ssa.gov website. So they're going to want to first create a My Social Security account if they don't have one yet. Okay, they can go to ssa.gov/myaccount, create that account. Once they are logged into their Social Security account, they are going to choose to sign up for Medicare and then choose Apply Online to get the wheels turning for that enrollment. If you have individuals who are not comfortable with technology, don't want to do things online, that is fine. You just encourage them to call the Social Security office to take steps to enroll in Medicare. We have the toll-free number here for you. They can also physically go to their local Social Security office to get enrolled, and they can do that through a prearranged appointment or a drop-in, but just know that they'll have to wait a little bit to be seen. Okay, before we move over to the special enrollment period, any lingering questions on the initial enrollment period, any of those common considerations? We'll give a minute and see if anyone has a question to pop into the chat.
Okay. So now, so if your employee did not enroll in Medicare during their initial enrollment period, probably because they were still working and they were on their group health plan, they can enroll in Medicare during a special enrollment period. So do any of you know how many months the Medicare special enrollment period lasts? This is another chance for us to interact. If you have a guess, why don't you throw it into the chat to see how long you think the Medicare special enrollment period lasts for? Any guesses? 90 days, okay. 3 months. Those are good guesses. So, during the special enrollment period, an individual technically has 8 months to enroll in Medicare after their group health plan ends. So 8 months is our answer. To understand how to help your employee transition to Medicare during their special enrollment period, there's 2 important questions to consider. So first, what parts of Medicare does the employee already have? Do they have nothing? Do they have Part A only? Or do they have Part A and Part B? Second, what benefits are offered at retirement or termination? So when an employee already has Part A and is enrolling in Part B past age 65, they must complete and submit these 2 forms to Social Security. The forms are the CMS 40B and the CMS L564 form. There's pictures of those forms here. These 2 forms can be faxed together or they can be dropped off at a local Social Security office with or without an appointment. And we're going to talk through these forms. So we're going to start out by looking at this CMS 40B form. So this form is to be completed solely by an employee. And you'll see that the first question requires the applicant to enter their Medicare number, which is why someone must already have Part A in place. And that's why we were talking about, like, okay, if this person's going to stay on their large group plan and continue to work and they don't have an HSA, yeah, enroll in Part A online or however you want to do it, just so that you have your Medicare number, so it makes it easier down the road. And this is that example. Now we're going to look at the L564 form, and this is called the Request for Employer Information form. And this is the form that you will interact with most. So anyone who has pushed off Medicare past age 65 is required to prove that they had credible coverage from the time that they turn 65 till when they're enrolling in Part B of Medicare, in order to avoid getting a late enrollment penalty. So the top portion of the form will be filled out by the employee. So section A is the employee's responsibility. The employee just wants to be careful as to how to fill out this form and to make sure that they that the applicant name and the employee name is filled out correctly. We see a lot of confusion around this. So for a person that is retiring past the age of 65, they're the ones that are on the work plan. They would list themselves as the applicant, and they would also list themselves as the employee. But if this is someone that's doing this for their spouse, the applicant would be the spouse and the employee would remain as the employee. So just getting that straight. And you are always going to be helping to fill out this form for anyone who has coverage through your company after age 65. So that's the employee or their spouse or their spouse. So we're now going to look at the bottom portion of this L564 form, which is filled out by the employer and is unfortunately the part that's most complicated and can be confusing. So we're going to walk through this together. So the first question on this form is or was the applicant covered under the group health plan? And so you're going to want to answer yes. If the person is not on your group health plan, then there's no point in you even completing this form. So it's always going to be yes. For question 2, Social Security is looking for the date that the coverage began. So we see this question answered incorrectly often. You want to be sure that you're putting the date that the applicant first started receiving coverage through your company, even if the plan has changed over time. So if the coverage does not go all the way back to when that employee was age 65, maybe that person had multiple jobs between turning 65 and, maybe 69 when they're retiring. That person is going to need to get these L564 forms completed by each company that they worked for during that window of time. For question 3, most of the time the coverage has not yet ended. So you'll want to check no, and then you can skip over question 4. For question 5, when did the employee work for your company? Most people will have a from date and then a still employed date. Medicare does not recognize any coverage that continued past an employment date. So if you put that they still have coverage, but the employment has ended, that will be a big red flag to Medicare and they might reject the application. And then finally, you're going to sign, date, and add your title and phone number to this form. A newer option that we've seen in recent months is the ability to enroll in Part B online. We are still recommending that the forms, the CMS 40B and the L564 form still are completed as they typically would be. Once they've completed the forms, an individual can go onto this webpage, ssa.gov/Medicare-Part B-SEP, and they can enter the same information that they put on the forms, the hard copies of the forms. When it asks to verify documents, you'll see that there's several. So there's these 2 places where they ask for verifying documents, and then they give you all these examples of different verifying documents that you can upload. We've experienced that these verifying documents don't really work. So the best recommendation is to instead upload copies of the 40B and the L564 form as those supporting documents and then submit them. So there are basically 3 options for employees that have neither A or B of Medicare. And they can enroll online in Part A, wait for their card to come, and then take steps to enroll in Part B, just like we walk through with that CMS 40B and the L564 form. They can also go to their local Social Security office and enroll in person with their completed L564 form in hand. They could also enroll online in both Part A and Part B of Medicare, and then simultaneously fax through a copy of their L564 form to their local Social Security office, or they could upload that L564 form online. Any of those options work. Employees with both Part A and Part B in place clearly don't need any assistance with enrolling in Medicare. However, they may need help lining up secondary insurance. Do we have any questions? That was a lot that we just went over with those forms. Just so you know, we field questions about these forms all the time. HR professionals reach out to us. We often are reviewing these forms for people that we work with to make sure that they're filled out correctly. We want to make sure that before these forms are submitted to Social Security, that they have all the correct information, because once they get submitted to Social Security, if there's something that's incorrect, it sometimes can just kind of sit in this abyss and in limbo, and can really elongate a person's enrollment process.
Is the special enrollment period only for group plans that are ending? So the special enrollment period is for anyone who is over 65 and is losing their group health coverage. And that can be voluntarily or through something like retirement or being laid off. So yeah, they can choose to make that decision.
And I want to just tag on to that. There are also other like special enrollment periods that apply to people that have been incarcerated, or there's all kinds of other special enrollment period categories. But this is we've talked about the most common today. There's a question that just came in.
Do you work with individuals that are already retired but not yet of age for Medicare?
So mainly we are working with people of Medicare age. We don't currently have like individual health insurance that we like have as products that we sell, but we're helping to prepare people for that Medicare transition. And we can help give guidance there. What am I missing, Cassie?
Yeah, I think often what comes into play in our office is maybe someone is retiring, able to get on Medicare, and maybe their spouse is not yet 65. And so we'll kind of brainstorm, provide some resources, and help that spouse fill that gap time. But that's the most common one we see here. We often aren't getting individuals in who need help navigating like the marketplace or something like that.
Yeah, and then also, this is a good lead in to the next section, because COBRA often comes into play when someone retires before age 65. So Cassie's going to be talking to us about COBRA. So how about you just take it away, Cassie?
Great, yes, and feel free to continue to pop questions into the chat. So this leads me into our next topic, which is common considerations that we see pop up for employers who are helping their employees enroll during a special enrollment period. So we'll look at proof of loss of coverage. We'll circle back to talk about HSAs one more time, and we'll look at also some typical coordination of benefits issues that we see for these folks. So for employees who are enrolled in both A and B and kept their group health plan as either secondary or primary, maybe because they had a dependent that still needed that insurance, or they wanted to use that prescription plan or dental plan, they will obviously, like Leah said, not need any assistance in enrolling in Medicare when they lose their employer coverage because they're already on it. But if they try to enroll in a secondary insurance, which about 50% of Medicare beneficiaries do to help fill in that 20% gap that I mentioned way at the beginning of this presentation, they will need to show that secondary insurance company proof of loss of current coverage. Okay, so I'm going to give you an example here. This is an example of what an employee might need from you. Some sort of letter showing that the employee had coverage with your plan and on what date that is ending. So really the start and end date is kind of the most important piece here. And while the special enrollment period to get onto Medicare A and B is 8 months when someone's losing their group health plan, if they already have Medicare A and B and are losing their group health plan, the special enrollment period to get a secondary insurance is actually only 63 days. So that one's a little bit tighter for folks. As we talked about earlier, some employees may push off getting Medicare Part A during their initial enrollment period because they want to remain on that large group employer plan. They want to continue to contribute to that health savings account and really build that up for retirement. It's a great strategy. However, it does require a little bit more planning ahead when they are finally going to enroll in Medicare Part A during a special enrollment period. When they're enrolling in Medicare Part A past age 65, Medicare can and typically will automatically backdate the coverage up to 6 months, but never before someone's 65th birthday. So therefore, even though they didn't enroll until that time period, the system will have a note that they were on Medicare 6 months before that. And so you want to make sure that both employee and employer contributions to an HSA stop at least 6 months before the employee takes action to enroll in Part A so that they can avoid that tax penalty. Coordination of benefits is the most common, I would say, thing that we see pop up for someone who worked past age 65, stayed on an employer plan, and then is now getting onto Medicare. Medicare keeps a database of all of those who have medical insurance through other sources once they're Medicare eligible. However, it does sometimes lag when it's updating this information for someone who's getting on Medicare past age 65. So it is not uncommon for new Medicare enrollees to get bills because Medicare thinks it is still somehow secondary to a work insurance. So this might fall to you because you might get a call from someone saying something like, I got a bill because you are still listed as my primary insurance. Didn't you cancel my coverage? So if this is the case, that employee should call the Medicare Benefits Coordination and Recovery Center at the number on the screen there. And once they get it cleared up with Medicare, it takes about 10 days for that database to update. And they might need to call their providers to have them resubmit some claims to Medicare and have it processed correctly. But it's a pretty quick turnaround. And then COBRA is another coordination of benefits thing that we see. So you might have the ability to offer COBRA to an employee who is retiring. And while it could be a great option for some, COBRA is not considered insurance under active employment. And therefore, if someone is over 65, COBRA would act as a secondary insurance, meaning that they have to get on Medicare A and B. So they can't look at COBRA and say, I will pay for that and I will push Medicare off. They have to get on A and B. They could keep COBRA as secondary, but usually the expense is not worth it for those people. However, what could be worth it is dental and vision COBRA. Most people will take advantage of that for as long as it's available once they've moved to Medicare. And then the last coordination of benefits consideration is severance packages. So severance packages, unlike COBRA, often work as a continuation of salary and or benefits as if the person is still employed. So if that is the case, that person can continue to push off Medicare until the end of that agreed upon time. So another example here for you. In this separation agreement, this employee is going to get 24 weeks of salary continuation. And with that, medical, dental, and vision coverage through that 24 weeks. So they can push off enrolling in Medicare until the end of that 24 weeks. As long as they don't go past their full special enrollment period, they're in the clear.
All right, thanks, Cassie. So we've covered the Medicare basics and various scenarios on how and when an employee might want to transition to Medicare. And we've looked at various factors that may play a role in why an employee might or might not want to transition to Medicare and how you can support them through this transition. And today, we also wanted to briefly provide an overview of an individual's options for coverage once they enroll in Original Medicare and decide to get their own insurance outside of what's being offered to them by their employer. So here's an illustration that helps explain the different Medicare-related plan options that an individual might have beyond Original Medicare. So in the middle of the illustration, you'll see the pie chart that shows that Original Medicare, Part A and Part B, and how it covers about 80% of the coverage or 80% of your medical costs. And Cassie was talking to us about that earlier. This would leave about a 20% cost for Medicare enrollees to pay. And there's no cap to that 20%. If they don't get coverage beyond Original Medicare. So most people aren't comfortable with that type of open-ended risk. So because of that, people will choose something. They'll choose one of these two paths on either side of this, of Original Medicare. So if we look to the path one, which is the path on the left, what's happening here is that person is keeping Original Medicare and they're adding in a Medicare supplement plan. Those plans are also called Medigap plans. And those plans help to fill in the 20% of coverage that Medicare doesn't cover. Sometimes people will choose to get a Medicare supplement plan. Sometimes people will choose to keep their Medicare or their employer coverage as their secondary insurance. That's for those people that are on those small group plans. Like we talked about, they can keep Medicare as their primary insurance, and they can keep their small group benefits as their secondary insurance. And I was mentioning this earlier, individuals could also choose to just keep their prescription drug coverage from their small group benefits. So on this path one, you'd have original Medicare, a Medicare supplement plan. Those two pieces would work together to cover doctor hospitalization. And then you'd also get a standalone Part D prescription drug plan to cover your prescription drug costs. So that's one option. If we look to the right of the screen, path two, these are considered Part C, Medicare Advantage plans. So these are those managed care plans or Medicare Advantage plans. And on this path, what's happening is you're actually giving up original Medicare and you're replacing it with a managed care plan that's provided by a private insurance company. So regardless of which path you choose, you're always going to be paying the $174.70, the Part B premium. The Medicare Advantage plans are required to offer you what is equivalent to what you would get through original Medicare. So they're required to provide you with at least 80% of coverage. On path two, you would often get extra additional benefits that Medicare doesn't cover, things like dental and vision coverage. So some employers also offer retiree benefits. Retiree benefit packages can look and work differently than an individual's traditional Medicare plan options. Often retiree benefits blend the two paths and health coverage features. So these retirees can access different benefits than just an average person could be able to access. We often meet with retired teachers or school district workers who are planning to retire and move to Medicare. And many of these individuals can access the PCERS Health Options Plan. And a lot of their health options plan have Medicare supplement-like structured plans that also include dental and vision coverage looped in. They can get access to premium assistance or premium discounts. These are all things that an average person who doesn't have accessibility to retiree benefits could not, access. Some other unique retiree plans that we've encountered are offered through the Veterans Administration, the Railroad Retirement Benefits Board, and federal employee health plans. And on these plans, an individual will have certain open enrollment timeframes where they can switch from one plan to another, but a fairly standard rule is that once that individual gives up those retiree benefits, they can't get them back. So finally, we wanted to be sure to mention that while it's incredibly important to assist your employees who are making decisions to move to Medicare, under the law, employers are prohibited from offering incentives of any kind to a Medicare eligible individual to enroll in Medicare instead of staying on the employer's health plan. So it's really important that you're really careful about that. Medicare is a complicated system. And as you can see, there's a lot of things that you have to factor in and that do factor into someone's Medicare journey. And we hope that the reasons that we listed at the start of the presentation are encouraging to you as you learn more about this topic. We do want to emphasize the importance of having a trusted Medicare resource that you can turn to when you have questions, and we do that for people all the time. As a reminder, Steve's going to share, the recording is going to be available of this presentation. Steve's going to share the slide deck, a PDF of our slide presentations and any helpful handouts. We also have an e-newsletter that we share with Medicare related topics for HR professionals. So it's a quarterly e-newsletter. If you would want to be on that mailing list, that distribution list, please feel free to include your email in the chat feature, and we'll make sure to include you and make sure you get those Medicare updates. The e-newsletter is called Medicare in the Loop. We wanted to say thank you to Steve and to the entire Indian Valley Chamber for allowing us to present on what we think is an especially important topic for HR professionals and those in management. So thank you again for having us today. And we're going to open it up for questions. So
we kind of pushed it right to
I know,
11,
sorry.
so I don't know if we have time to put some wiggle room in here for questions, but Steve, we'll leave that up to you.
Yeah, why don't we take a minute or two and see if anyone has any questions? I will say, I did hear you say also that both of you are available for consultation, probably both for the HR professionals and also their employees. Is that correct?
Absolutely. Yeah.
But if anyone has any questions for the whole group, this would be a good time also. It was interesting when we first set this up. I was thinking to myself, my goodness, what are we going to talk about for an hour? And wow, you filled up that hour. Sue has a question. So she's saying add her to the email list.
All right, gotcha, Sue. We'll add you.
Yeah, let's go ahead and close this out. I'm gonna stop recording and then finish up here.
Yeah, so Jeannie said, can we get contact